So one very, very common misconception that I see happen all the time is that lab tests are an accurate and reliable way to assess somebody's nutritional status. And the reason for this is because albumin and prealbumin in the literature have been shown to not be sensitive enough indicators to somebody's nutritional status. We had a patient who had a chronic GI disorder, and she was denied surgery because her prealbumin was too low. The physician really wanted the prealbumin above a certain level, and in order to accomplish that, the surgeon tried to put the patient on TPN and tube feeds, both at full strength. If a physician suspects that somebody's malnourished, he or she should consult the registered dietitian. The registered dietitians are the ones who have the training to assess somebody's diet history, somebody's weight history accurately, do the nutrition-focused physical assessment, and really determine if a patient falls into the criteria of moderate or severe or even mild malnutrition.
That's probably one of my favorite misconceptions. So thinking that as a dietitian, I'm going to force someone to change. And I have encountered this with some of the physicians that I've worked with. They'll come to me and they'll say, Leah, I need this patient to lose 50 pounds in 2 months, A1C 12 to under 7. I need them to start exercising, and I need them to start packing lunch. I need these 4 things. Can you go do that? And sometimes I'll joke with them if I know the physician well and say, I can't go and cook all their meals for them to help them lose 50 pounds. Really, we use motivational interviewing as dietitians to help elicit what they're willing to do. We don't force them into anything. We have them tell us the things that they're willing to do, and we help create things like SMART goals, so very targeted goals that are going to help them meet the needs that they want.
There may be a misconception that nutrition is not a priority for patients, physicians holding this misconception. I don't think it's a true misconception. I think that physicians are well aware of it. I think that they, unfortunately, though, are juggling so many aspects of the care that this is an easy one to fall by the wayside. And that's where having a dietitian involved with each team in the hospital, each team in the clinics, and us being the one to consistently lobby and push for maintaining adequate nutritional care is appropriate. Yeah, so there have been times too where maybe we're sitting in rounds together or standing in rounds and there is a patient who is obese and the physician may say something like, well, we aren't sure about the function of their GI tract and we're gonna just keep them MPO for a while. They don't need any help from you as the dietitian. I may say to the physician, when are they going to be able to eat by mouth? And if that's going to go any further than 1 week, let's make sure that we're getting them some type of nutrition support to enable them to get the calories and the protein that they need to heal these wounds.
One very common misconception is that dietitians are dietary, and we hate that. We're not part of the food services department, which is what dietary refers to. We're part of clinical nutrition. I remember a time at multidisciplinary rounds where we were all gathering around the patient board getting ready to do medicine rounds. And the attending showed up and happened to have a first-year resident with him for the first time. And so he went around the circle introducing everybody. This is so-and-so from nursing, this is so-and-so from pharmacy, and then he gets to me and says, this is Janine from dietary. And he got everybody else's role right except for mine. So I had to correct him and say, no, I'm the dietitian, I'm from clinical nutrition. Dietary is food services. I think it's important in any working situation that you know the people that you're working with, and it just shows a level of respect for how you contribute to the team and what you do. It would be great if physicians knew that dietitians were not part of dietary, that we were part of clinical nutrition and referred to us as such. And also if they could learn to spell dietitian correctly, 2 T's, no C, that would be great.
One of the misconceptions that physicians have is they'll ask me to go see a patient, maybe just for a brief moment, and they'll say, give them one of those carb counting handouts with the big picture of the plate. And actually the other day, I saw a patient and the physician was saying, I'm not really sure why the patient always has high numbers after lunch and moving into dinner. Just give them one of those handouts we have on carb counting. And so after going in and meeting with that patient, I realized she has a side business. And her side business is a bakery. And so before lunch, she samples cupcakes and cookies. During lunch, she eats her salad exactly as she told the physician. After lunch, there are more brownies and cookies to sample. So I think giving that personalized touch is something the dietitian can do. Anyone can give a patient a handout, but oftentimes if you give someone a pamphlet or a handout, where do you find it? In the garbage, right by their desk or their bedside. And so we really provide something and make it speak more to the patient. And I would say that I think patients find a lot of value in that.